If you have diabetes, you know that your annual eye exam is absolutely non-negotiable. But let's be honest, figuring out the cost can feel like you're playing some kind of high-stakes guessing game. Well, today we're going to change that. We're going to take all that "is this covered" anxiety and turn it into a clear, simple, mistake-proof plan. By the time we're done here, you will have the exact words to say when you book your appointment so you can finally put a stop to those dreaded surprise bills.
Oh man, we have all been there, haven't we? Just sitting in that waiting room, doom scrolling on your phone, hoping you checked all the right boxes. That feeling of uncertainty, that's exactly what we're going to solve today. This isn't about trying to game the system or anything like that. It's just about understanding how it works, so you can focus on what really matters, your health, and not all the paperwork that comes with it.
All right, let's get right into it. The root of almost every single surprise bill comes down to this one key idea, something I call the billing fork. Think of it like a fork in the road. It's that one moment where your appointment can split into two totally different financial paths, and it often happens without you even knowing it.
And here it is. So on one side of the fork, you've got your routine screening. This is the preventative lane, the just checking for damage visit when everything feels stable. But on the other side, you have the diagnostic visit. This is the problem-solving lane. It gets triggered if you mention new symptoms or if the doctor happens to find something new. Look, neither lane is right or wrong, but the trouble starts when you don't know which one you're actually in.
This, right here, is the absolute key to everything. You can walk into that office intending to have a simple, routine checkup. But the moment you say, my vision's been a little blurry lately, you might have just quietly changed the entire billing story for that visit. The final bill follows what the visit officially becomes, not what you wanted it to be when you walked in the door.
Okay, so now that we get the billing fork concept, let's talk about the rules of the road. We'll start with Medicare Part B. What does it actually cover when it comes to diabetic eye care? Knowing this baseline is so important.
So, Medicare Part B will typically cover one annual retinopathy screening every year. But here's the detail that trips everyone up. This is a medical exam to look for signs of disease, like diabetic retinopathy. It is absolutely not a routine vision exam to get a new prescription for glasses. In the eyes of Medicare, those are two completely different things, and they're billed completely differently.
So what about what you have to pay? Well, with original Medicare, the math is usually pretty straightforward. First, you've got to meet your annual Part B deductible for the year. Once that's paid, you're generally on the hook for 20% of whatever the Medicare-approved amount for the exam is. It's that classic 80-20 split you've probably heard about.
All right, but even if you've got the basics down, there are two kind of sneaky hidden traps that can catch even the most prepared person off guard. These are the little details that can make a big difference in your final bill.
The first trap is surprisingly simple, and it's a question most of us would never think to ask. Where is your doctor's clinic physically located? It seems like it shouldn't matter, right? Just a logistical detail. But it can have a huge impact on how much you pay.
Here's why that location is so critical. The very same doctor could work in two different places. If their office is a standalone private practice, you will probably get one bill for their service. But if that same clinic is technically considered a hospital outpatient clinic, you could get hit with two separate bills for the exact same exam. One from the doctor and another one called a facility fee from the hospital.
And this is just so important to understand. When you choose a clinic, you're not just picking a convenient spot on a map. You're actually making a financial decision. Just knowing to ask about the billing location gives you a level of control that, honestly, most people don't even realize they have.
Okay, on to hidden trap number 2. This one is for you if you have a Medicare Advantage plan. Now, these plans can be fantastic. They often have extra benefits, but they come with their own unique set of rules that you absolutely have to follow to the letter.
This chart does a great job of laying out the differences. With original Medicare, you have the freedom to see pretty much any doctor. With Medicare Advantage, you might get a nice predictable copay, but you've got to stick with doctors in your network, and you might even need to get approval from your plan before your visit. The risk really shifts from, is the service covered, to, did I follow my plan's specific rules?
Okay, this is the best part. Let's take everything we've just learned and put it into action. Here is the exact word-for-word script you can use when you call to book your appointment.
This is it. This is your magic sentence. You don't have to be a billing expert. You just have to be really clear. This one sentence does it all. It clearly states your purpose, it asks about the visit type, it confirms that billing location we talked about, and it even asks about any extra tests. It's your all-in-one tool for a no-surprise visit.
So, to recap, before you hang up that phone, you want to get clear answers to these 3 questions. Number 1, visit type. Number 2, billing setting. And number 3, any other expected services. Getting these 3 confirmations up front is your absolute best defense against the surprise bill down the road.
But what happens if you do everything right and you still get a bill that just doesn't make any sense? First of all, it happens. The most important thing is not to panic. Here is your calm, simple, step-by-step rescue plan.
Your goal here isn't to argue. It's to gather information. So you start by calling the clinic's billing office and just calmly asking for an itemized statement. That'll show you exactly what they charged you for. Then you can compare that list to your plan's rules and ask really specific questions to both the clinic and your insurance company.
I really want to leave you with this thought because it's just so important. Getting a confusing medical bill can feel personal. It can feel like you did something wrong. You didn't. It is almost always just a paperwork event. And paperwork events have steps and they have solutions. So be persistent, but please don't be hard on yourself.
Now, before we finish up, I have to make one thing absolutely crystal clear. Everything we have talked about today is for scheduling routine care. If you are experiencing any of these symptoms, things like sudden vision loss, a bunch of new floaters, or what looks like a curtain in your vision, your one and only job is to get to a doctor immediately. Your health and your sight always, always come first. So there you have it. We've talked about the billing fork, the Medicare rules, those 2 hidden traps, and most importantly, the script you can use to protect yourself. The power is really in your hands now. Which leaves me with just one final question for you. What is that one 5-minute call you can make today to take back control of your next appointment?